the DTx Circle podcast by Wellthy Therapeutics. We'll be featuring leaders from across life sciences, health tech, and healthcare to explore how the power of digital therapeutics and software as a medical device can transform lives by addressing global, unmet clinical needs. Your host, Karine and Soulat, will be joined by experts from Europe and around the world to understand the real power of DTx in changing the future for patients and improving health outcomes at scale.
Hello, Maneesh. Maneesh Juneja is our guest today. Thank you for agreeing to join us as a guest on the DTx Circle podcast. We are very grateful for your time and look forward to an exciting and enlightening conversation. So, Maneesh, to begin, you are a digital health futurist who explores the convergence of emerging technologies to see how they can make the world a healthier and happier place. You look at the technologies in the context of social, cultural, political, and economic trends, helping organizations to think differently about the future. Tell us more about your consulting work in healthcare, please.
Yeah, so in terms of my consulting work, it's not just about where we are heading in terms of all these different trends converging, but most of the time, my clients, whether they are a hospital, whether they're a health insurer, whether they're a government organization or a pharmaceutical company, it's about understanding how do we innovate? And not only how do we innovate, but how do we prepare for a radically different future? So some clients are just saying, look, Maneesh, we are just looking for help 2 to 3 years in the future, what's coming, we should be maybe acquiring or partnering with certain organizations. But then some clients are saying, Maneesh, we really want you to challenge our senior leadership and help us understand the range of possibilities 20 to 30 years in the future. What do we need to start doing now as leaders in this organization so that with all these changes coming up over the next few decades, how do we stay relevant to the needs of our customers, both now and in the long term?
Okay. And actually, in your website, you were saying that you believe that the products and services that will have a biggest impact in our healthcare system will not come from healthcare, actually. You were saying that it comes from outside. Can you expand a little bit on that?
Yes, I will elaborate on that because my time, for example, when I've worked in pharma myself for almost a decade, analyzing real world data like electronic health records and insurance claims data sets for drug development, drug safety, one of my frustrations, well, everyone's frustration was you're trying to analyze the natural history of disease and you've got information from the electronic medical record which describes the patient came in once in January, 6 months later they came in, their symptoms worsened. But what happened in those 6 months that causes symptoms to worsen? Did they stop exercising? Did they suddenly use the car instead of using the subway? Did they change their diet? Were they sleeping differently? All these parameters where, in terms of that real world data, that is data that is being generated, but not necessarily being captured. And maybe occasionally we're using things like wearables and other sensors to capture data, but we don't necessarily have this picture of someone's health outside the four walls of the hospital, that 360 view of someone's health. And that is what's needed to integrate with the electronic medical record to really have an understanding of health and also disease and disease progression and how well medications work in the real world. And so that's why I talk about actually it's whether you are flying on an airline. Can the airline possibly track your health as you fly or when you're driving? Or whether you're at home, it's your smart home technology. Can that be used to collect information about your health in the real world outside of the doctor's office that can possibly link back with healthcare and certain interventions?
I see. So what you were saying in a way is that we should also take people data from the day-to-day life. And that's what will help.
Absolutely, yes.
That's an interesting point because very often in chronic disease, we are spending like 30 minutes with the doctor, whereas we are living more than how many hours? I mean, we are living the whole life with the disease, and we're just spending half an hour per year with the doctor. So there's like a very big difference, and there's lots of small symptoms that hidden symptoms or hidden things that we don't see when we don't speak about with the doctor, that we might gather and get, as you were saying, in an airplane, or somehow we can get this information. If I have to ask you, what role do you think digital solution such as software as a medical device or DTx, digital therapeutics, are playing in the current shift in thinking beyond the pill? What do you think about that?
The ultimate goal in healthcare and pharma is going to move beyond just improving patient outcomes, because that's for people who already have a disease. We're going to see an increased focus on how can we prevent people from getting unwell in the first place. So because healthcare and pharma are not sustainable in their current format, this is partly why pharma has been looking at beyond the pill as a strategy in previous years. And we can't afford to have more hospitals, more pills, and more doctors. So digital solutions like software as a medical device and DTx, how can they play a role? So I think it's about finding new forms of value and new payment incentives, especially with respect to getting paid for preventing somebody from getting sick in the first place. So this is, again, almost a wild, wild west. We're still working things out. We don't necessarily know a lot about how this will evolve, but we are heading in the right direction when it comes to beyond the pill, that we are moving from just selling products to selling platforms in the case of DTx. So to give you an example there, if you look at the car manufacturers, the whole industry, they've realized they can't just keep selling more cars every year. So they are moving from selling cars to selling mobility as a platform. So potentially when it comes to going back to healthcare and pharma, it's about, in the same way that car manufacturers are moving to mobility as a service, whether it's ride hailing, whether it's e-scooters, whether it's subscribing to cars rather than buying them. So for pharma and healthcare, it's about health as a service enabled by these new digital solutions. And then it comes back to ultimately, though, where does pharma fit in with these new digital solutions in terms of payers saying, moving to a world where they pay for events not to happen in somebody's life, like a disease, paying for a disease not to start.
Also, when you do a parallel with the car industry, which I think it's very interesting. I love parallelism. It's a service, as you say. Whereas when you look at preventing health, which you said it should go into preventing from being sick, then it's like, don't you think it's not a service we provide, but like a burden for the people? It's like to prevent from something that didn't happen yet. So I'm like, if you prevent, it's hard to go into preventing, because you don't know if it's going to happen to you. So you're going to do like very specific things in your life in order to prevent to have cardiological issue, for instance, but you don't know if you're going to have issues. So I'm thinking of that,
Yeah, so you make a good point there, because let's just say there's an intervention that someone pays for that reduces my risk of a cardiovascular event. But we are not going to know until the end of my life whether that intervention was successful in reducing the risk, because we need to wait until the end of your life to gather the data, right? So it may be that instead of paying for prevention in that naive way, we're paying for prevention where risk factors are modified in terms of, okay, look, we're going to take a cohort of people and we're going to modify their risk factor, which one of the risk factors we know is obesity for certain diseases. So if this digital solution can be used to modify the risk factors by 50% in terms of people reducing weight, then that is something we can pay for in terms of prevention of disease.
Another question would be, how should pharmaceutical company go about evaluating DTx solution, digital therapeutic solution providers?
I believe it's about going beyond the traditional measures of evidence, such as clinical and economic outcomes, but it's about looking at new forms of evidence, such as patient experience, patient satisfaction, and then even aspects such as how well does this digital solution integrate? And does it even offer benefits that people weren't thinking about a few years ago, such as now many organizations and governments are concerned about climate change. So some are committing to net zero. For example, the NHS here in the UK has pledged to be they're the first healthcare system to pledge to be net zero, right? So when we think about DTx, how can DTx be used to reduce carbon footprint? Whether it's lower emissions from reduced visits to a doctor, because things can be done remotely with the DTx, or even reducing the carbon footprint of making a pill in a factory. So this, I feel, is, again, this ties back into the sustainability agenda, which is going to be sort of planetary health is going to be intertwined with human health. So more and more, I feel that, so if I spoke to a pharmaceutical company today, I would say when it comes to DTx or even the provider, your unique selling point as a competitive advantage is, hey, look, this DTx is actually going to make a difference when it comes to the environment and our carbon footprint. And that's how we can differentiate ourselves from another provider that has a similar DTx in this therapeutic area, but they haven't even quantified the environmental impact in terms of benefit of using our DTx. Does that make sense?
Yes, I think it makes a lot of sense because very often we hear that patients are feeling bad about environmental issues. What about the type of digital solution you predict that will be the biggest driver of personalized care?
I believe that's a solution that can provide this 360 view of someone's health in real time. So again, whether it's someone's health at home, in the office, in the car, exercising in the park, or inside in the hospital, it's about linking all of that data together to understand when someone's health is changing, right? And providing the right intervention at the right time. So when we think about widespread personalized care, we're having pockets of innovation here or there in different areas, but it's not widespread, it's not integrated. And, we are struggling at the moment in many countries to even link the data from somebody's wearable that's capturing their physical activity or their sleep to the electronic medical record to improve things like in terms of risk stratification and when to intervene. And so this real growth is going to be all of this patient-generated data outside of the four walls of the hospital. So when it comes to digital solution, is it going to be that one of the global technology giants that covers so much of our lives, whether it's e-commerce, whether what we're watching on TV, whether what we're ordering for food, and they have all this information, they can say, we have this global data set of what people's health and behavior is, and we can integrate it into healthcare? Or is it going to be a new startup that comes along or new entity that says, we are the first in the world to have this all-encompassing view of someone's health outside of the hospital? This is still not clear, but this is where, if we really want to get to widespread personalized care, we need to have this information integrated into the medical record somehow.
It comes back to what you were saying at the beginning when you said that we have to take into account all the data from the day-to-day life. So for you, if I summarize what you just said, the type of digital solution you predict will be the biggest driver would be a solution that take into account the holistic part of the person. Not only the data from a wearable alone, it has to be integrated. All the data has to be integrated.
Yeah, so that possibly requires new collaborations, new partnerships, new consortiums, because even within a hospital, we have these computer systems that don't talk to each other. So when we're thinking about this holistic vision, we really need to say, well, who needs to be at the table? Who's got the capability to gather all this data and link it all together so that we can make better decisions, earlier decisions when it comes to somebody's health.
So actually, when I'm listening to you, I'm thinking interoperability, for instance, is like a major element for each DTx solution. Otherwise, it's not worth going into the market somehow. Because if you're not interoperable with the other system used in the hospital, then you cannot integrate all the data, and then you don't get all the insights. If you had to invent a single digital therapeutics or software as a medical device or any digital solution to solve a challenge in healthcare, what would it be?
So for me, when I've been looking at solutions and problems in healthcare and digital, for me, it's fall prevention. So I was reading a report from the WHO talking about the estimated almost 700,000 fatal falls occur every year, making it the second leading cause of unintentional injury death after road traffic injuries. And this is 80%, over 80% of these fall-related injuries are occurring in low and middle income countries. So when I think about a digital solution or digital therapeutic, not just about preventing falls, such as improving somebody's balance, their mobility, even their vision, for example. And I'm thinking of when people get older, but then smart home technology. So in the event of a fall, what can we do to spot that somebody's fallen, they're living alone, and spot that they've fallen in their own home, and to get the right intervention, the right person, the right help? Because especially if we think about aging populations, not just here in Europe, because this is a huge challenge and it's going to be a bigger challenge over time, but globally. And if we want this future vision of people aging in place in their own home independently with dignity rather than in an institution or a long-term care facility, then we're going to need to find ways to use digital to really try and prevent as many falls as possible. This is and when somebody falls over and they're admitted to hospital, it is not just obviously sad for the person involved, but it's a huge economic burden for the healthcare system when somebody gets admitted due to a fall.
I like the idea. Let's do a digital solution to prevent falls. That's interesting. Even not to prevent falls, but at least to know how to get how to prevent falls and to get solution when you fall, because sometimes you cannot prevent it. I agree. That's interesting. Very interesting. It could be like with cameras and I guess with signals when there's something wrong that happens in the house of the people.
And just Karine, may I just say a quick follow-on comment when you mentioned about signals? So with a lot of these digital solutions, they are very good at detecting signals that couldn't be detected before, or we can detect them earlier. And when I speak to a lot of healthcare professionals, they say to me, Maneesh, my biggest concern is there's all these technologies that are generating these new signals and potentially allowing me as a healthcare professional to intervene or know who's at risk that I didn't know they were at risk before, but I can with these new signals. But I don't have the resources, and the system itself isn't set up to enable me to act upon all these signals that AI is detecting every day. So that's just one concern that healthcare professionals are sharing with me about, well, this is why I'm not that hot on digital solutions, because I can't act upon the signals generated by digital solutions.
Yeah, it comes exactly with the next question I had in mind. It's how do you think healthcare professionals actually perceive digital solutions? So can you add a little bit on this part?
Absolutely. So, I must have spoken to hundreds of healthcare professionals around the world in my work. And I think there's a spectrum of responses, and it depends upon the specialty of the professional, what type of patients they see, as well as their own approach to digital solutions. And I've met many healthcare professionals who are passionate about digital solutions because they love technology themselves, but they're actually frustrated with getting these digital innovations into the actual delivery of healthcare, right? But then others are skeptical because the patients they care for are below average income, below average when it comes to digital literacy, or not interested in using digital solutions. And I also see fundamentally many healthcare professionals don't trust digital solutions, partly because nobody has involved them in the process. So whether it's something like a new electronic medical record system where the IT system department of the hospital just says, here you go, this is a new electronic medical record system, or it's even a new wearable being trialed, and fundamentally, no one's asked them, well, how will this integrate with your clinical workflow as an individual healthcare professional or as a group of healthcare professionals? And so this is where it is about involving healthcare professionals from the ground up when designing these new digital solutions.
If I hear you well, there's three things. System not prepared. I mean, the system is not organized, or the organization of healthcare is not done in order to receive this type of solution. Patient sometimes doesn't want to have the support of a digital solution. And then you have the trust part, which is like HCP sometimes don't really trust into the clinical outcome, let's say, of a digital solution, because they haven't been involved enough in advance in order to see how it can change. And if we were thinking of let's say an HCP that has embraced one digital solution, what would he said? What would be the positive element you have heard from HCP saying, now I have changed my way of working and now I'm working with this digital solution. This is what I have found. Does it happen?
Yes, it does happen. And if I may share a personal example of that. So the pandemic has been a turning point for many, and it's forced many healthcare professionals to embrace digital solutions because they don't have any choice. And I'll give you my personal story here. So I was diagnosed with COVID April 2020. Ended up being long COVID, where I ended up being unwell for over a year, but I'm recovered now. But when I had my initial symptoms, and at that point in time here in the NHS in the UK, there was no way you could see a doctor face to face, right? In terms of your GP. So when I phoned my GP had to listen to my symptoms over the phone, as in my story, try and make a diagnosis over the phone based upon what I'm describing. So when I said, hey, look, I've got like 2,000 pounds of sensors at home, some of which are medical devices, some of which are just fitness or wellness sensors. Like I've got a smart ring, I've got a watch that can take a 30-second ECG. I've got a sensor in my bed measuring my respiratory rate when I'm sleeping. Would any of this patient-generated data be useful? Now, in the past, if I said to my GP or most healthcare professionals, here's this data from a patient's own home with sensors that you may not have heard of, and they're offering to share that data, they'll say, no, I don't trust it. It's not clinically validated. But during the pandemic and at the start, my GP said, Maneesh, whatever data you can share with me to help me diagnose and rule out certain diseases, that'll be fantastic. So not only did they accept, and it was so useful to them in their clinical decision making in terms of ruling out disease, when I said, well, let's do a 30-second ECG with my watch, let's share the respiratory rate data from my bed for the last few nights, and it helped them. But then when I ended the phone call and I checked the NHS app, I looked in my medical record, and they've actually put in the data from my bed and my other sensors into my medical record. So this is a real turning point, and in future conversations, they were still willing to take this information from me. So I think that this is starting to spread, that as a healthcare professional realizes that it can make their life easier, they can have more information for their clinical decision making, and they can possibly do things which mean that when you are seeing a patient at a distance and you're using a digital solution, it can improve patient outcomes. It can lead to the improving their clinical workflow.
Yeah, that's great what you say. Actually, I have an example also to provide. My father has a cardiological issue, and I went to see his doctor with him, and we talked to the nurse, and I said to the nurse, he has an Apple Watch with ECG. Do you think it's relevant? And the nurse could answer. She didn't say, no, it's nothing interesting. She said, yeah, Apple is good. It's better than taking the other. I mean, I don't want to do the publicity for Apple, by the way, but it's just saying that yes, it has data, clinical data that prove that it's a good ECG data set. So I was very impressed because I thought she would say, no, we just do it at the consultation, not outside,
But Karine, is this partly because it's about the healthcare professional might trust a digital solution that comes from a consumer brand that is not necessarily part of healthcare, because they have a lot of trust with that consumer brand because they use so many different services from that brand. So whether it's an Amazon, whether it's Samsung, whether it's Apple, whoever it is, but you have this inherent trust because you're a consumer, and suddenly as a healthcare professional, you're using a digital solution from them, and you have a greater degree of trust because you're using that brand as a consumer as well.
Maybe you're right. Maybe there is a part of this which is like that because you trust on the brand, and there is also this clinical outcomes, clinical research or trial they've done in order to prove that the ECG provided with this watch, for instance, is trustable or accountable. But I like your idea. It's also because you use as a consumer this brand that maybe you are relying on this brand. That's true.
So it's also, Karine, about those touch points, digital touch points. So if you think about in the modern era, all the different touch points we have with a consumer brand, whether it's Apple, Samsung, Amazon, whoever, or in China, you've got Alibaba, Tencent, etc. But if you think about these digital touch points that we have, and many of them are quite seamless and intuitive and frictionless for the consumer. And then in healthcare, the problem is that there are individual interactions which may or may not be digitally enabled, but a lot of them are still throwing pieces of paper around with patients that expect you to travel somewhere and wait for 3 hours to do some simple encounter with the healthcare system. So it could well be that these DTx providers that are coming up and they've got a clinically validated solution, but they don't necessarily have a well-known brand as a small provider, they integrate with one of these large consumer brands who say, we already have this great consumer experience with all these different digital touch points. You get to integrate into our ecosystem, our platform, and you instantly reach 200 million people around the world, possibly, as customers.
That's very insightful for the future, I would say. Wow. That's incredible. If we go back from today, how can we improve healthcare professional and patient adoption of digital solution today, I would say, not in the future, but because in the future, I like your point of view, but if we are looking at what role does trust have to play here today, what would it be?
So, Karine, in terms of improving HCP and patient adoption of digital solutions, I know that there's still work underway because this is an emerging area in terms of regulation. But I think what's going to convince people is having a gold standard of evidence of digital solutions, just as rigorous and robust and transparent as the evidence needed for a new drug or vaccine, right? So that's the first point. The second point, which I mentioned earlier, is about involving people from day one in the design of these new digital solutions, whether that person is a healthcare professional or a patient. And they need to be involved throughout the life cycle. So it's not just about the beginning, having a focus group with a few patients, but having them involved all the way from the design right through to implementation, deployment. And the third point there is integration. So it sounds really boring. Maneesh keeps talking about integration, but we have so many silos within healthcare, processes and policy which have been set up to keep things in a separate domain. And what's happening with some digital solutions, we are ending up creating digital silos with different data sets in different places. And we need to integrate everything together so we can have that seamless experience. So that is, again, we've got to think about what is going to make life easier. And we've got to think about not just the clinical workflow for the healthcare professional who's already overwhelmed with administrative burden, but we've got to think about the patient workflow as well. So yes, we can save them a visit to the doctor's office if they use a DTx, but are we making their experience as frictionless as possible in their own home or wherever they happen to use that DTx?
It's if they have to do one click instead of three, we are winning somehow. When we say to integrate the meal of in the DTx, in a solution, if he has to type every time the meal he has done instead of having it would be a burden. Whereas if you just take a picture of your meal and then it integrates directly the element you are eating, it's kind of positive to adopt a digital solution. I see your point. What about the human relation between HCP and patients thanks to digital solution?
So that's an interesting question. I believe that this depends upon the situation. So we have, these extreme views such as healthcare should always be face-to-face. The healthcare professional has to be able to physically examine the patient. But when it comes to areas such as mental health or sexual health, would some patients feel comfortable or prefer a digital solution via a machine or AI rather than a human healthcare professional because they feel that this machine, this algorithm, isn't going to judge them the way a human HCP might judge them? I'm thinking about mental health and sexual health, things that are very personal and in some countries are very taboo. You wouldn't even speak to your family members about this, let alone a doctor. So it could be that a digital solution like a chatbot is the better or preferable solution for some patients. I also think it's about not having a one-size-fits-all solution. So having a wide variety of tools, different ways for people to access care, depending upon what their needs and preferences are at that time. So it could be that same patient who prefers to use the digital solution for a mental health problem. For knee pain, they want to be physically examined by a human healthcare professional because they know, hey, look, there's no digital solution. Even if I take a picture of my knee and I do some physio, some exercises with a DTx, I want to actually see a human being touch my knee. They can feel where the pain is. I can't just describe it in virtual reality.
And what about the human link, let's say, or whatever is the link actually between pharma and HCPs? Do you think digital solution can help to broker trust between pharma and HCPs?
Yes. So when it comes to pharma and HCPs, there have been moments where pharma has lost the trust of some healthcare professionals, whether it's an individual interaction or just the perception of the industry. I think it boils down to value and transparency. So how do these new solutions, these DTx solutions, these other digital solutions, how do they genuinely offer new forms of value to somebody as a healthcare professional, but also to the system as a whole? And that these digital solutions, they're not going to cause me a bigger headache in terms of impacting how I do my job, whether I can get reimbursed or not. And I also think it's about transparency. So especially in the case of DTx and artificial intelligence, but AI just in general, people are concerned, not just in healthcare, about things like bias. Will these algorithms be fair if they've been trained on Caucasian data and disease, and we're applying them to a general population that has people of different ethnic backgrounds? Will it be able to decide the intervention or decide the right treatment plan? So this is where, with pharma companies and HCPs, pharma, especially when they incorporate these digital solutions and they speak to HCPs, they need to be as transparent as possible. Hey, look, we accept that these algorithms may not be fair today as much as they need to be, but this is what we're doing to mitigate the problems with bias and fairness. This is what we're doing with ethics of AI and our algorithms in DTx's. And we want to work with you on addressing your concerns about AI in digital solutions.
And by the way, I have a question, last one, let's say. When we talk about digital therapeutics, do you think my question is maybe not right, actually, because you were talking about AI, and I think there is a lot of lack of confidence in AI. But digital solution or digital therapeutics are not having so big amount of AI in a way. It's like more like, as you were saying, different type of data that we are gathering, integrating into a platform somehow. And we can have a bit of AI, but we don't have so much AI that it's too complicated for HCP or for pharma to manage somehow.
Where I'm coming from in AI and digital therapeutics is when it comes to behavioral health, or in terms of predicting what to do, what should the digital solution do next? What should be the next step in that intervention? And this is where AI and algorithms are being used to actually, help these solutions figure out what's the next step, what's the next stage, and again, thinking about personalized care and moving away from one size fits all. So yes, AI may not be a huge component within digital therapeutics today, but in years to come, as they develop and they become more complex and they try and address different parts of healthcare, it could well be that AI takes a bigger role. And this is again preparing now for those future developments, so that your organization, the framework, everything is ready to handle these new challenges arising.
Yeah, that's the futurist part of you that is speaking. So Maneesh, I have a quick fire question for you. If you weren't in pharma, digital health, what would you be doing?
So I think I'd be working and travel in some way. I've traveled to 54 countries. I love traveling, meeting new people, experiencing new cultures. But when I say travel, I'm thinking maybe in an airport or a hotel, because I've had sometimes wonderful experience in an airport or hotel, sometimes really bad experience. And so I'm really passionate about how could I use my skills then to help a hotel or an airport deliver the most fantastic customer experience time after time.
Well, thank you, Maneesh, for this very interesting conversation we had. And I wish you a happy day. Let's talk next time together. Bye.
Thank you for joining us on the latest episode of the DTx Circle podcast by Wellthy Therapeutics. Information on how to find out more about our guests and the work that we do at Wellthy Therapeutics is available in the description below. And if you've enjoyed hearing from the latest and greatest in life sciences, DTx, and software as a medical device, please share, like, and subscribe. See you next time.